Easily find, book, and manage your travel nursing assignments with the AMN Passport app. Download today. Tell me a little bit about the results of the program so far that you've seen. How are you measuring your outcomes, and what have your outcomes been?
So, good question. Our residency program is accredited through ANCC, and so we have a certain level that we need to make sure that we really, a certain standard that we meet with our program. So for that, we have program goals that we set, and so we're measuring things like their critical thinking, their engagement in the organization, if they precept or not. So those are things that we're going to look at and really evaluate our program. How good are we doing with that? We give a couple different surveys. We use a Casey Fink, which is really the standard, I would say, for transition to practice programs. We look at that a few times, and we'll actually change different residency sessions based on what they say. So if they say 6 months in that they're really having trouble with understanding patient deterioration, and we see that on the survey, then we might have a breakout session that's going to be, how do you recognize a deteriorating patient? What interventions do you do? And so we'll customize that per cohort based on what we're really seeing from the surveys.
Okay.
So there's a lot of data that we get from that, and that we base how really well we're doing on. And really kind of the tried and true is that we look at our retention and turnover. Are we able to retain our nurses? What are they doing in their organization? If we do retain them, are they becoming preceptors? Are they going into leadership positions? So really our first goal was to increase retention, which we have tremendously. Yeah. We've been able to have 100% retention in pretty much in the last 2 years. We had one cohort that we've got 95%. So averaging out in that. But yeah, that was a really big feat for us, is actually keeping them that first year and giving them all of that good residency support that we can give them. Yeah. So we actually track all of our residents and their retention for 10 years. And so we're going to be a while before we're actually going to see that far, the impacts of our program. But really that first year and that second year retention is our focus right now. And what we've seen so far has been really great. And I think a testament to the modifications that we're able to make and the structures and really the strategy that we're using.